Thank you everyone for joining us. Today is actually the first series of our Health Talk for Speech Therapy Day 2022. So before I hand the time over to our wonderful speakers, I would like to share with everyone the house rules for today. So if you're familiar, maybe we'll go through this a couple of times. So if you have any questions, do use the Q&A button at the bottom of the Zoom window. And then the chat is disabled. So if you have any issues or technical issues, do also address them in the Q&A function button at the bottom. Okay, and then my moderators will help to facilitate whatever issues that you're having. And also at the end of the session today, we will be also having a feedback form. So we actually appreciate if you can help us fill that in to help us improve our future health talks. Okay, so without further ado, let's start our health talk. Before we start, I just want to let everyone know that due to the clash in our speakers' schedule, some of the talk segments are pre-recorded. So if you have questions along the way, do not worry because our speakers will join us at the later part of the webinar to address all your questions. So do keep the questions coming, drop them in the Q&A button if you have any along the way. Okay, enough of me talking. I'll now hand the time over to our first speaker, which is Dr. Ang Kok-Yang. So he is actually an associate consultant from TTSH Dental Surgery Department. So he'll be starting off today's health talk on oral health in the elderly population. So let me quickly share this slide. Yeah.
Hi, good morning. I'm Dr. Ang Kok-Yang. I'm a dentist working here in Tan Tock Seng Hospital. I've been invited by the speech therapists today to share with all of you some information on oral health in the elderly. Here is what we'll touch on today. Oral health, some misconceptions, importance of oral health, how to keep our mouths healthy, how to brush for someone else, and when to seek help. Have all of you been to the dentist before? Most people find a trip to the dentist uncomfortable, if not scary. And I agree, it can be scary too sometimes. So do you visit the dentist regularly? If you do, great. But if you don't, that's not too good, because not going to the dentist, you will not know if there's any potential issues. A lot of people still think that there is no need to visit the dentist often. In fact, even till today, many people feel that if there's no pain, there is no need to visit the dentist. Well, the idea of seeing a dentist only when there is pain is a very incorrect concept. Though we say even after you lose your teeth, you can replace them with dentures, it is actually never quite the same. Dentures can move while you're eating and talking. They can drop out, and they do not provide the same biting strength compared to your own teeth. So, why should we see a dentist regularly and from your youth, in fact? It is really to maintain your teeth and your gums. Regular maintenance helps our teeth and gums remain strong, clean, and healthy. And any minor problems can be caught and rectified before it becomes a bigger issue. In fact, regular visits can also help to keep dental costs down. For example, without any form of subsidies, scaling and polishing usually costs around $150 per session. That would only be a cost of $300 if you go to a dentist twice a year. A set of dentures can cost anywhere from between $500 to $4,000 depending on complexity, and a single dental implant can cost something between $2,500 to $10,000 depending on complexity and where you go to have it done. So, regular dental maintenance is still the most cost-effective measure in the long run. And what do we do when we see a dentist? It's just to remove the hardened dirt, like the left picture. And then after scaling and polishing, it becomes clean and nice and healthy like the picture on the right. In addition, there is increasing scientific evidence to show that having a clean and healthy mouth is beneficial to our overall health. A clean and healthy mouth has so far been shown in new evidence that it may possibly lower your risk of heart attacks, lower your risk of getting dementia, and also help with your control of your rheumatoid arthritis. And there is strong evidence that with a good, clean and healthy mouth, it helps you to achieve better diabetic control and reduces the risk of aspiration pneumonia in people with known swallowing dysfunction. Just to explain a little bit further, aspiration pneumonia is infection of the lungs, which happens when someone with a swallowing problem accidentally has food from or blood from the mouth entering their lungs. They can get quite sick. So, how can we keep our mouths clean and healthy? Simple. It's actually very basic and simple via good, effective toothbrushing and flossing. Bacteria sticks to our teeth and gums very firmly and can only be removed effectively by thorough brushing. Gargling with a mouthwash will not be able to remove all the sticky bacteria stuck to our teeth. Also, our teeth and gums and mouth needs time to rest, so snacking the whole day long or sipping on your bubble tea the whole day long will definitely result in dental issues. How to brush your teeth effectively? There is actually no real right or wrong method to toothbrushing, but most dentists will recommend using a soft toothbrush and placing the toothbrush against the gums at a 45-degree angle, brushing 1 to 2 teeth each time in a circular motion gently. Toothbrushing like this will take about 2 to 3 minutes to cover all the teeth in your mouth. You can use an electric toothbrush if you think it helps, but it is not always necessary for everyone. We recommend daily flossing, either with conventional floss or the use of floss sticks like the picture on the lower right. For people with bigger gaps between the teeth, we recommend the use of interdental brushes instead, which is the picture on the lower left. And how to floss your teeth effectively. We recommend getting a long enough length of floss, winding it around your fingers first, and then sliding in between your teeth in the upwards and downwards sweeping action, rather than a left-right sawing action, because that might hurt the gums. And how to use your interdental brush. It is just like how you use a toothpick, by pushing it gently through the gaps in the teeth and then going through 2 to 3 times. Of course, a toothpick is quite hard, so we will usually recommend the use of an interdental brush. And what happens if a person is no longer able to brush their own teeth? Then someone else will have to brush their teeth for them, be it a family member or a helper. It's important to have a clean mouth before going to bed, as having a dirty mouth would mean that we are actually feeding the bacteria in the mouth, and this will eventually lead to many dental issues. Brushing only in the morning is too late, as all the damage would have occurred. We have created a video that is on YouTube to teach people how to brush teeth for other people. So feel free to look at the video on your own time. And finally, if you have an elderly at home who is unable to communicate well, when should you seek professional help? You should seek professional help when there is obvious facial swelling with or without fever, sudden refusal of food when they usually eat well, refusal to be touched on the face, or refusal to toothbrushing when they used to allow it. If a person has not seen any dental professional for more than 1 to 2 years, having a dental examination is always encouraged just to know if there's any issues. For patients with dementia, sometimes spitting out of food, holding food in mouth without swallowing, and teeth grinding may not actually mean that there is a dental issue. Maintaining oral health in the elderly may seem like an uphill task, but it's never too late to start. If in doubt, just bring them to see any dentist that is comfortable in seeing elderly people. And that's all I have to share with you today. Thank you for your time.
Okay, thank you, Dr. Ang. So now we will actually move on to the next talk segment. So if you have any question on any oral health about about the topic that's shared by Dr. Ang, please do use the Q&A button below and type your questions over there. So for the next segment, it's actually shared by Miss Francoise Lim. She's our principal speech therapist from ENT and which is ear, nose, throat department. So she's actually sharing on how aging can impact our voice. So give me a moment. I transit. Yeah.
Whenever you're ready.
Good morning, everyone. Today, I will be speaking on the aging voice. I will cover how voice is produced, how aging affects our voices, where to seek help, treatments available, and lastly, how to take care of our voices with simple exercises and tips. How do we produce voice? When we breathe out, the air from our lungs flows up past the vocal cords, which sit in the larynx or voice box, and causes them to vibrate to produce sound. This sound is then shaped by our tongue, teeth, and lips to form speech. Resonance is when the voice is enhanced by the nasal and the oral cavities. We don't just talk with our vocal folds or our diaphragm. These three subsystems, breathing, voicing, and resonance, have to work in a coordinated manner. Aging can affect our voice in several ways. At the level of the voice box, the muscles may atrophy or shrink, mucous membranes get thinner, and the joints get stiffer. The person may experience more effort to speak, and the voice may sound weaker and breathier. Apart from the vocal folds, the muscles in your vocal tract, such as your tongue, may also atrophy or weaken, making articulation less clear. If you have missing teeth or have poor fitting dentures, the way you pronounce words may be impacted as well. We may also have reduced lung capacity, causing us to run out of breath before completing our sentences. Here are pictures of vocal folds when they come together. The one at the top left is of normal vocal folds. You can see that the vocal folds meet nicely in the middle. The other picture on the right is of an aging larynx. The vocal folds are thinner and slightly bowed, causing a gap between them. Melinda, go back, please. Thanks. Because of this gap, air leaks through the void and the voice is softer, breathier, and weaker. Of course, there are different degrees of severity, and not everyone will experience voice problems to the same degree. Hearing ourselves helps us regulate our voices, but when hearing deteriorates, we may not be able to hear ourselves well, especially in noisier places. Coupled with the possibly softer and weaker voice, we may then force our voices out to make ourselves heard. This can cause strain and injury to our vocal folds, making us hoarse. Do put on your hearing aids if you have them, as they will help with communication. These are some typical symptoms of the aging voice. You may sound softer, you may tire when you talk, there is loss of projection and resonance, your voice may be a bit shaky, you may be weaker or breathier when you speak. The pitch lowers in women and it gets higher in men. See an ENT doctor if your voice issues bother you and are interfering with your day-to-day living. Gradual voice changes are a normal part of aging, but it may be a good idea to consult a doctor to rule out any problems. Hoarseness, for example, can be a sign of growths on the vocal folds, reflux, or other neurological conditions. In some cases, hoarseness can also be a sign of laryngeal cancer. This is how the examination of your larynx or voice box is done. The doctor puts a flexible scope through the nostril and slides it down towards the voice box. The patient is asked to say "ee" so that we can look at the movements. It is quite a pain-free procedure and takes about a minute or two. The vocal folds vibrate at an average of 100 times per second for men and 200 times a second for women. Because of the fast speed, the vibratory characteristics are best viewed with special equipment using a strobe light. Besides looking out for any growths or abnormality in the voice box, we also look at the movements of the vocal folds and whether the vocal folds can come together completely, known as glottic closure. In this video, you can see the vocal folds coming together. The movement and symmetrical. This is a video of an aging larynx. Notice that the vocal folds are thinner. And let's play the video, please. Folds do not meet completely, and you see a gap between them. The voice also sounds weaker and strained. Treatment depends on what we find. Often, voice changes from aging respond well to voice therapy. Voice exercises and techniques are taught to improve the function, quality, and stamina of the voice. In cases where therapy alone is not enough, the ENT doctor may then offer surgical intervention, such as bulking up the vocal folds with a filler or inserting an implant. The aim is to reduce the gap between the vocal folds to give the patient a stronger voice. Your doctor will be able to discuss the options in greater detail should you be a suitable patient for such a procedure. Medication does not help restore an aging larynx. However, if you do have concomitant problems like nasal allergies or reflux, medications may be prescribed to help with these issues. Okay, so not all is gloom and doom. I will now go through some simple exercises and tips to help your voices. But before I carry on, let me say that these exercises are helpful when done correctly. However, if done incorrectly, they can make your throat tighter or your voice worse. When in doubt, do check with your speech therapist. Now let's start with diaphragmatic or abdominal breathing. So as mentioned in my earlier slide, breath support is one component of producing a good voice. When you breathe in, your diaphragm tightens and moves downward. This allows your lungs to expand. You may notice that your lower tummy may appear to get bigger. Let me just show you. I'm going to tilt the screen down a little bit. So if you put your hand on your diaphragm here and you breathe in, you should see your hand rising. And when you breathe out, breathe in and breathe out. Okay, so when you breathe out, your diaphragm relaxes and expels the air from your lungs, and then your tummy appears to be flattening down. So when you do this, you should feel your throat relaxing. There should be no discomfort in your throat or your chest. Okay, let's move on to the next slide, please. So lip trills are a good exercise to do for warm-ups. What you do is you place your fingers on your cheeks like this, gently lift them up. Now pay attention to the breathing as we had gone through before. Take a breath in and then once more. Okay, now add in a voice. So your throat should be quite comfortable. You should not feel like you have to force your voice out, and your voice should be clear. Moving on to the next exercise. Humming is again another good exercise. Check your breathing. Breathe in and say hum, hum. I want you to feel the vibrations on your lips, in some of your teeth if possible, but nothing in your throat. Again, your voice should sound easy and clear. Let's try that once more. Okay, so this exercise helps you to place your voice towards the front of your face and nothing in the back of your mouth or in your throat. It improves your resonance. You can try these exercises 1 to 2 times a day. Just do 3 to 5 repetitions of each. If you feel any throat discomfort or worsening of your voice when doing these exercises, please stop and check with your speech therapist how you should be doing them. Okay, and here are some tips on how to take care of your voice better. Drink enough water. As we age, our saliva production reduces. Our vocal folds need to be well lubricated in order to vibrate freely and efficiently. So it is important to keep yourself well hydrated. Water does not come into direct contact with your vocal folds when you drink, but hydrates us systemically. So take small sips throughout the day rather than large amounts at one time. If you are on fluid restrictions due to a medical condition, please check with your doctor. Caffeine is dehydrating, so do limit drinks such as coffee and tea. Avoid hard actions on your vocal folds, like throat clearing and shouting. Okay, so when you clear your throat very hard or you shout, your vocal folds repeatedly slam together and can cause injury to your vocal cords. If you have phlegm in your throat, do sip and swallow rather than clear your throat. Avoid shouting unless there's an emergency. Avoid things that can irritate your throat. Cigarette smoke dries out and irritates your vocal folds, causing them to become swollen and red. As also, we know that people can develop throat and lung cancers from smoking. Certain foods can cause reflux. Examples are spicy, caffeinated, citrus, acidic, and oily foods. Reflux can come up the food pipe and spill over into your voice box, making it swollen and causing changes to your voice. You may also experience more phlegm in your throat or feel as if there is a lump in the throat sensation. Do reduce these foods. Finally, aging is inevitable, right? We all age at some point or other. So our voices are affected by changes in our bodies as we age. Keep yourselves healthy, keep physically active to maintain good muscle tone, posture, and stamina, all of which contribute to a healthier voice. Like other muscles in our body, our vocal folds become weaker if we don't use them. So use your voice regularly. Make it a point to speak to someone every day. Read aloud to yourself or sing without straining, of course. And with that, I thank you for your attention.
Okay, thank you, Francois. Okay, so we have come to the last segment of today's sharing session. So up next, we have our final speaker. He is Mr. 𝗬𝗵𝗹. He is the principal medical social worker from the Department of Care and Counseling. So he will be ending today's talk by sharing with you how to manage caregiver burnout, as well as the type of support and resources you can find in the community to help you out. Okay, so one last one.
Morning, everyone. I'm Sam here, social worker with Teaching Hospital. Glad to join my colleague this morning for TTSH Speech Day talk. And today I'll be sharing more on support for caregiver as they render care and support for the loved ones with swallowing or speech impairment. This morning I will be sharing on the impact on communication and swallowing on our caregivers, and then also to share with our participants when to look out and when to seek for help, and also I'll be also covering some tips on how to manage and prevent caregiver stress or burnout. And lastly, I'll share some key community support resources that caregiver can tap on to support them in this caregiving journey. So, as we all know, if a patient develops speech or swallowing impairment, it will impact on the communication, their communication to the person and the people, and also the quality of the relationship. Because we have been relying on speech to communicate with people around. For patients that have developed some swallowing impairment, could not partake normal intake of food. That could also impact on this interaction with the loved ones. That feel very, they could feel very affected, or they could feel that now that they cannot partake with their loved ones and friends, they may choose to withdraw from such events. So next, I think we will move on to share when, because caregiving is a heavy and long process. What are some of the signs we can watch out for ourselves? Know that it's time for us to seek additional support and help us to continue to provide caregiving to our loved ones. One thing that we can watch out for ourselves is that we start to feel worthless, guilty, or sad. That could be a sign that we could be having some significant caregiving burden or maybe some caregiving stress. Another thing to watch out for ourselves is that we experience thoughts of inflicting harm ourselves or our carers. This is something to watch out for. So if caregiver have experienced anger and this negative feeling of wanting to hurt herself and also the carers. Another sign to watch out is feeling tired, frequent, and lethargic in wanting to feeling very demotivated, because the caregiving process can be overwhelming and stressful. Another sign to watch out is that you start to resort to healthy behavior like consuming alcohol or medication to cope with stress or providing care. So we start, if this is not part of our so-called because of the process of providing care to our loved ones, that to consume for medication to help us cope with our stress. So having known some of the warning signs of caregiver stress, burnout, what are something we can do to help ourselves prevent us from getting to burnout caregiving journey? One thing we can help to manage our emotions. This caregiving process can result, bring about our stress, and that could bring about the building up of all these negative and unhealthy emotions. So from time to time, find time to talk to our friends and relatives trust, so as to share with them our trouble, share with them our burden, that they could provide us with some. There's no need that sometimes the source of help to us. They help us troubleshoot, find other resources or ways to help you cope with caregiving. The other important thing that we can help us continue this journey of providing care, to take care of our own health. A lot of time when we are so involved in providing care to our loved one, we neglect our own health and well-being. So, always remember that unless you are healthy, then you can continue to provide care and support to the loved one. So don't neglect things like, having adequate sleep, having a healthy diet, having taking time to exercise. So all this would help keep yourself mentally and physically healthy, continue the journey of providing care. The other one is to prioritize and manage our various responsibilities. On top of providing care and support to your loved ones, also have other responsibilities, juggle with job, providing care to your other family members, and also involvement in other areas. So important while you have all these many tasks to juggle with, you need to prioritize what are the important and key ones to attend to. Those that may not be important now, you may increase them or delay them to another time when you have more time and resources. It's important to manage, prioritize as you attend to, and not to overwhelm yourself on top of the responsibility. Next, you could also have time, find time to do things that you enjoy. Hobby like reading, going for a short walk, or a walk in the park, or simply finding time to have coffee, chatting with your friends. So these are good distractions from responsible providing care. Next, also not to remind yourself not to take all this caregiving responsibility upon yourself. Always, look for other family members or loved ones that you could share this care responsibility. In the event that if there are limited so-called family members or loved ones that you can tap on, could also tap on some of the available community support services to support you in this caregiving, which I will share some of it in the later part of this talk. And the other one I think to be mindful of is to be shy, if that you're being overwhelmed with this caregiving responsibility. To seek help and support and not to be shy about it. So earlier I shared, if we don't have that many family members or resources to fall back on to help us providing care to our loved ones, there are actually community support programs that we could tap on to help us support care of loved ones. Do have this to discuss your doctors or your social workers so that they help to plan and source out some of the support services that help you with caregiving. They are largely, some of these communities are largely classified into two areas. One is the home-based and one is center-based. Medical escort and transport. There will be voluntary welfare services staff to bring your loved ones for their appointments in the hospital and clinic. This again are some support to share with you the caregiving burden if you don't have enough family resources or loved ones to fall back on. The other one is what we call center-based services. Center-based means instead of pushing the services to your home, send your loved ones to some of these center-based services like daycare and day rehab services centers. So in the morning they'll be fetched to center-based services to participate in programs and services at these centers. And then later in the afternoon, then they come back. During a good part of this day, your loved ones will be taken care of and participating in programs at this center-based access. That will give you time to go run other things that are errands or do other things you need while the ones is taken care of. Okay. There are also various support groups run by organizations like Dementia Support, 𝗘𝗍𝗹𝗶 Caregiver Welfare Associations, 𝗙𝗏𝗍 Caregiver Support. You could also render support to caregivers. There'll be other caregivers who are also undergoing the same journey, coming together in support group to share ideas how to help each other in caregiving. Of course, so to render each other emotional and psychological support as caregivers. As shared earlier, I think care, the process of providing care is not only psychological, physical, sometimes the cost of providing care for patient at home can also compound, add on to stress. There are various government schemes administered by care to help Singaporeans defray some of the financial costs of providing care support for their loved ones. I'll just touch on here to share with participants. One is the Pioneer Generation Disability Scheme. So if patients need 3 out of 6 activities of daily living, and they need assistance on this, they can actually apply for this Pioneer Generation Scheme, a payout of $100 and contribute towards care of patient. So what do you mean by activity daily? Say for instance, the patient need help transfer on the bed to wheelchair, the chair. Patient need assistance to feed themselves, need assistance to shower, or need assistance to move or for the toileting. So there are 3 out of the 6 that they cannot help, need assistance, then potentially could apply for this Pioneer Generation Disability Scheme. The other one that I think commonly we help a family apply for is the foreign domestic worker levy profession. So I am getting a foreign domestic worker to help me to support the care of my son at home. Instead of paying the $300 market value, I need to only pay $60. So these are some key schemes that could help give some of the financial burden of providing care and support to one's at home. To one more assistant in this area, you could talk to or call up NSC to make more inquiries. What are some of the potentials to qualify for and how to go about applying them. So just to summarize, I think the key points for today on short sharing is that remember, I think caregiving is a heavy responsibility that require support and help. So be shy, ask for help them rather than shouldering it all on yourself. Then you may run risk of turning into caregiver burnout. The other thing that I think we need to be mindful of is that we need to physical and psychological help to continue this caregiving journey. So we must also take care of ourselves first to allow us to carry out well this caregiving responsibility. And so the other thing I think we need to be mindful is we must also watch out for ourselves when we are under stress. This caregiving role, with sense that we are under stress and going into burnout, we should start to seek help to support us in this, to bring in other people and resources to help us this caregiving journey. And last is seek help early. Don't wait till really gotten into caregiver stress or significant caregiving burden, then you start to seek help. By then, some damage may be done, or there may be lesser option to help you to cope with this caregiving responsibility. That's all I have to share with you. Thank you.
Thank you. Okay, thank you all the speakers. I hope everybody has. Okay, no worries. Okay, so thank you everybody for tuning in. So we have reached the Q&A segment for today. So let me just quickly share the slide. Yes, okay, so now you'll have about 15 minutes for you to ask your questions. Our speakers are actually here with us at our webinar. So if you have any question, do type it in the Q&A button below. And then maybe I'll give you all 1 minute to think about what you want to ask. And then yeah, we do see questions coming in already. So we will wait a bit more and then our speakers can take over and answer your questions. Okay, so we actually have one question in the Q&A. Maybe okay, they're actually all answered type. So if you have any more, do keep them coming. Yeah. Okay, so we have one more questions from Wei Yiyan was wondering, Dr. Ang, do you want to answer the question live? Doctor, you unmute yourself. Yeah.
Sorry. Yeah, I think this is a very complicated question to answer because the most critical issue here is that for elderly patients, a lot of them have a lot of other medical conditions. So any form of general anesthesia may not be that safe. So it's important to first determine whether the dental issue is really critical and which is actually more beneficial for the patient, whether it's intervention for the dental problem or whether it's so critical that having to go under general anesthesia is absolutely necessary because we do not want, of course, the patient to suffer because of the general anesthesia. So my personal advice would be still the same. If you suspect that there is any problems, bring the person to a dentist that is comfortable seeing them. Try to get an idea of whether the dental issue is critical enough, and if it's critical enough, the dentist can probably advise you further on whether general anesthesia is necessary or not.
Okay, thank you, Dr. Ang. Yes, so keep the questions coming. Our speakers are here to answer them. Yeah, so maybe we give about 1 to 2 minutes for you all to type your questions in the Q&A box.
Hi, so we've got another question from somebody about receding gum issues. I think even if you have fantastic oral hygiene and have been taking care of you or yourself very well, just like the presentation from speech therapists, with aging, you have to expect that there's some changes to your body, right? And so even in the best of us, even if we take good care of our own teeth and gums, there will be a little bit of receding gums. The most important thing is the rate of the receding gums should be roughly progressing around the age that you are aging at, the rate that you are aging at. So if, for example, you are, say, 50, and you can see that the receded gums have gone all the way, exposing a lot of the tooth structure, then surely there is something that is not quite right. So any dentist will be able to help you with this issue.
Dr. Ang, maybe we give a question all the way to 11:25. So we have 2 more minutes. So if you have any question, do quickly type them down. And then before we do our closing. Okay, we have another question on toothbrushing. Maybe Dr. Ang, you want to look at it? Yeah.
YouTube.
Yeah.
I
So-
think they are asking about the YouTube address.
address. Okay, can that one. Okay, so for 𝗷𝗵𝗹, don't worry. My colleague will actually drop the link in the chat, so you can access the video through the chat. Yeah. Okay.
Okay.
Yeah.
Just to recap, I've just pasted a link to the MSF website. On that website, if you scroll down, you can find a list of dentists that are a little bit more comfortable to treat patients with special needs, be it young adults or patients with dementia. So hopefully that can help all of you to find a dentist suitable for yourself.
Great. Yes. Okay. So the links for the YouTube video as well as the list of dental services for elderly patients are available in the chat. So if you are interested, you can click on them. Yes. So it's 11:25. So if there's any question, we still can answer at the end of the segment, but I'll start off with closing today's session. So firstly, yes, thank you for joining us today. So we hope it has been a fruitful session and to learn more about swallowing, communication, as well as wellness in our aging population. So before you go, we do want to hear from you. You can scan the QR code over here on the screen to share with us your feedback. Alternatively, you can also type the link into your URL on your browser window to access the form. Alternatively, this link will also be sent to you after today's session. Yeah. And also, next, just wanted to publicize some of the upcoming talks that we are having. So for today, we have completed part 1 of series 1 of the Speech Therapy Day Health Talk series. So we actually have a part 2 that is coming up next Friday, and our registration is still open for part 2. So you can scan the QR code on screen, or you can access the link in the chat box that we will be sending later on. Or then we also have our last talk of 2022 happening on 14 December. So it is actually on TCM approach to neck pain and DIY acupuncture exercises. So if you know anyone that can benefit from the talk or will be interested, do share with them the link, of if it's for yourself, you can scan the QR code on screen as well. Yeah. And yeah, so actually this is the last part of our health talk session. Thank you everyone for joining us today. If you have questions, please feel free to continue typing them now. We will stay open until until 11:30 lah. Yeah, about 3 to 5 minutes more, so we can answer you through type answer. So you still can ask your question. If not, thank you so much for joining today. Yeah, and then till our next health talk, have a nice day and goodbye.
you asked that whether you have a tendency to get sore throat fairly easily and what could have caused this. Sometimes if you have a tendency to strain your voice, i.e., if you're having a lot of tension when you speak, that can cause sore throat, especially, if you use your voice professionally, i.e. if you're a teacher or if you have kids, and you have to raise your voice quite frequently. So some of the exercises that Francoise talked about inside her sharing earlier, actually you can try some of that because it helps to basically relax your throat muscles as well. So things like the humming, things like the lip trilling, those can be quite good exercises to keep your throat muscles relaxed when you speak. And also the vocal hygiene things that she mentioned, like things like drinking more water, ensuring that you're well hydrated. So it may be the cause of your sore throat. There may be other causes for you getting sore throat. If you bring this up to your GP, they may be able to give you some kind of diagnosis or further investigation, but it can be caused by tension when you speak. So you can try some of those exercises.
Yeah, thank you, Bowie. Thank you so much. Hi, so it's 11:31. We'll be closing the room. If you have any question, you can get in touch with the speech therapy team. We will leave their email in the chat box if you wish to reach out to them. So thank you, everyone. Have a nice day.